All right, Mom. So we're going to examine baby now. So I'm going to wash my hands first. Yeah.
Start the exam with the baby on the parent's lap to keep the baby most comfortable. And start with the heart and lungs while the baby is still quiet.
And I'm going to clean off my stethoscope. Yeah. We're going to clean this off and listen to you. What do you think of that? Hmm? What do you think of that? Okay. Hi. I'm going to listen to you first before I make you cry. Yeah.
Notice that we are auscultating in the same 4 areas as adults. This should be done both sitting and lying down when possible. Also, different pressures are used for the diaphragm and the bell effect.
Yeah. Now I'm going to listen to your back.
When auscultating the lungs, listen in the same areas as you would in the adult.
What a good boy. Okay, I'm going to listen right here. If I can get that thing. Yeah. And then we're going to go on this side. Thank you, Mom. And then we're going to listen up at the top. Good boy. That all sounds very good. Yay! Now we're going to start at the top of your head. And there's your anterior fontanelle. It's about this big still, Mom, which is normal. It gives his brain room to grow in there. So you have a little bit of cradle cap, which is normal. Lots of babies have that. And that's a little nevus. Yes, that Derm has seen. And there's no other masses or anything. And I'm going to feel, actually I'm going to look in your ears. What am I doing?
Note how one of the fingers holding the otoscope is braced against the face for stability.
Mom, can you hold
Also note that you may need the parent's assistance with the baby's hand.
I know. Okay, good job. Right. That looked good. Let's look on your other side. Good job. Yeah. Yeah. And now I can see those pretty eyes.
Here we are looking at the conjunctiva, the sclera, and the pupils of the eye with the otoscope.
Yes, I am. Mm-hmm. I see. Yes, I do. Good job. Very good. Yeah, good job. Now I'm going to look with another light in your pretty eyes. Oh. Yeah, this one. There we go.
Here we are just simply looking for the red reflex.
Oh, there you are. Yep, there you are. And now I'm going to put on a glove and put my finger in your mouth. Oh boy. Yeah. You can chew on it. Yeah. Let's see if we feel any teeth.
Using a gloved finger, we are palpating for teeth buds, an intact palate, and the suck reflex.
What do you think? Doesn't taste like very good, huh? Doesn't taste very good. Yeah, but you have a good suck. Okay, and now I'm gonna just make sure.
When checking for nasal patency, plug up one nostril with a finger and observe for breathing, and repeat with the other side.
I know that one's not so fun, huh? Now let's look in your mouth.
Good boy. You've been such a good boy.
Oh.
Let's see what we can see in there. Let's see what's in your mouth. What's in your mouth? Ah! I know, that's so yucky. Oh, there we go. Good boy. Good boy. And now I'm gonna
Note that earlier we palpated for lymph nodes in the neck. Here we're palpating for masses in general. Of course, this can be done in one exam rather than separately, as we are demonstrating here.
Lay you down on Mama's legs. Okay. Like that.
Yeah.
And I'll keep him here, and we're gonna
Listen to your tummy. Yeah. You see it?
I hear some good sounds in there.
Oh, good.
Relax a little bit though.
Now you're trying to sit up. Oh my goodness.
You may have to wait a little bit for the baby to relax the abdominal muscles in order to palpate for any masses.
Good. That all feels normal.
Good job. Now I'm gonna feel your pulses. And I think for the rest we will put you on the bed, if that's okay, Mom.
Mm-hmm.
I'm right over here. You stand next to him with me. Okay. So we make sure he doesn't fall.
All right.
Okay. So we're gonna look in your diaper. I know.
During the GU exam, we are looking for any redness, swelling, or discharge from the penis,
Okay with no
and for 2
redness.
descended
And we're just
testes.
gonna make sure there's one. Well, sometimes two. Yes. And then we're gonna feel your pulse right here. Good
Yes,
job.
we're
We're gonna feel your pulse right there. Good job. Then we're gonna feel your pulse right here.
Good boy.
Good job,
honey.
And then we can put your diaper back on.
Next, we're going to check for congenital hip
And I'll just
dysplasia.
leave it like that for
With the
a minute.
Barlow maneuver, we are gently pushing down towards the table with the knees flexed and together to potentially cause a posterior dislocation. This is followed by the Ortolani maneuver, where we are spreading the knees and gently lifting the hip to potentially relocate a dislocated
And
hip.
we'll just look at your toes. Look at your toes. Let's see if we can. Oh, you're doing it spontaneously. Oh, there we go. Oh, there we go. There we go. And then put your diaper back on. And his back is nice and straight with no little dimple. Yeah. Okay, one more thing. I'm gonna roll you on your tummy and see what you do.
Note the palmar grasps bilaterally and the good neck tone with a straight back and no head lag when he's pulled up. This is present at 4 to 5 months.
Put you on your belly. Let's just
Note how he maintains his head above the plane of his body with ventral suspension. This is present at 3 months, even though he doesn't demonstrate the full Landau reflex where the feet should be up as well as the head.
What happens then?
Note that in the supine position that he is able to hold his head up at 90 degrees. This happens at 3 to 4 months. That he's able to churn towards his mother's voice. This happens at 3 months. That he's able to bear some weight on his forearms. This happens at 3 to 5 months. And that he almost is able to roll over. This happens at 4 to 5 months.
Good job.
Finally, note that he's able to bear some weight on his legs as he's passed to his mother. This happens at 3 months.